Marc Francis. I'm the Chief Product Officer for Electronic Caregiver. Electronic Caregiver, we're a digital health technology and service company headquartered in Las Cruces, New Mexico. Addison is a virtual caregiver that we have built over the last 5 years. We're showcasing at HIMSS, and then we're going to be launching Addison later this year. Electronic Caregiver, our focus is really how to drive the highest level of patient engagement, and through patient engagement we get care plan compliance and better outcomes as well. Everything that's in our existing portfolio of products is then taken to a next level of engagement through Addison, a virtual caregiver that's in a patient's home and with him or her 24 hours a day, 7 days a week, to really drive the most intimate and engaging experience possible around care plan delivery and compliance. Addison is what we call the face that we put into the brains of our remote patient monitoring solution. We were founded in 2009, and we have tens of thousands of patients receiving remote patient monitoring care today. They're doing it all through voice and touch-driven interactions with products. While that's very, very effective, adding a visual representation of a caregiver and having that visual connection, we believe, and then that's been confirmed through our user testing, that it's going to drive a level of engagement, involvement, and fun for the patients that's really going to make a big difference in terms of outcomes. Folks have been blown away by Addison. Everything you hear about the technology buzzwords of artificial intelligence, augmented reality, machine learning, all are built within Addison. And then Addison presents all of that in a friendly, engaging persona to be able to work with a patient throughout his or her care journey. What people like about Addison is we've developed 8 different Addisons, different ages, different ethnicities, different genders. Addison can speak to you in your native language as well. So if you're a Spanish speaker, you can engage with a Spanish version of Addison if you would like in the Spanish language, and the ability to further customize Addison for your desires and for your needs to provide the best care possible for you. We've been doing a lot of work as a company, as with many other health technology companies, around COVID. We've done numerous COVID to home initiatives. There's a lot of work, talk about a hospital to home type program. We've been doing that for the last couple of years around COVID. So what we've been able to do with our existing technologies is be able to take folks out of a hospital setting into a home setting to provide care. Addison is going to be able to provide a next level of engagement around that. With Addison can help address the shortage of professional caregivers. Those are both caregivers providing home-based care and personal care, as well as clinical care as well. For both categories, there's a dramatic existing and exasperating shortage of caregivers. And now with Addison, you can have a virtual caregiver at home 24/7, and then the professional caregiver will receive information through a secure web-based portal, can look at the information, assess what the results are, and then target interventions for those patients that are trending in a way that shows that their health might be decompensating, but doing it early enough to prevent an expensive episode, as opposed to what happens today. Nobody's looking at information, and the person ends up going to the emergency room in much worse health conditions, and then a much more expensive intervention happening. What we've seen is that people would like to be able to customize their Addison. When we first were developing Addison, there was one Addison, but as we took it out to our users and spoke to them about what their needs are, they said, I would like to be able to choose age, gender, ethnicity, the language in which I'm speaking to, because the more we can make it and give people choices and be able to speak to them and meet them where they are, the more compliance we're going to have with care plans and the better outcomes are going to happen as well. It was funny, when we were doing some user testing, one of the ladies that we're working with, who's an Afro-American lady, said, this is the first time I've actually interacted with an African-American caregiver, and for her it was thrilling to be able to have that type of interaction, and she was already seeing Addison as a caregiver for her to augment her human caregivers as well. So that was thrilling. We also give the ability to do fun things like customize our outfits, customize a room that Addison's in, customize a house. We've developed both American style and European style households as well. So as we expand, we'll continue to get feedback from users to say, what can we do to make the Addison experience, as much yours as possible? Because through that, we'll get more utilization and better health outcomes as well. COVID-19 did affect many companies. What had happened in the telehealth space, it resulted in a lot of services that were used occasionally to go mainstream because patients couldn't go in to see the doctor or feared going in to see the doctor because of all the things happening around COVID. The demand for telehealth grew significantly. At first, that was really virtual visits, but soon people realized that virtual visits are one part of telehealth. And then we had a corresponding increase of usage for chronic care management, remote patient monitoring, audio and video televisits, transitional care. So there's a whole bunch of other elements of telehealth if you look at it holistically. And what happened with COVID is you had both an increased demand for those services from both the patient and the provider, but also changes in reimbursement. So now these services that were not really fully reimbursed became fully reimbursed and then fully part of a care plan for a patient. And it's made a big difference for folks. At Electronic Caregiver, we have a portfolio of different products and services that we offer. We do everything what's called personal emergency response. We do remote patient monitoring with a smart health hub that doesn't have a screen. We then have Addison as well, which takes all of that existing technology and then adds a visual interface with it through the screen as well. That's some of our hardware that we have. In addition to that, we also, over the last 6 months, have hired 120 individuals to staff a clinical triage center. So that's CNAs, RNs, licensed clinical social workers, care managers. And what we've done there is we saw customers saying, it's great to be able to provide all this equipment, but somebody needs to look at the data coming through them and then inform the doctor what needs to happen. A lot of folks do that themselves. Others asked us, if you staff up, you could do that for us. So we took the initiative to do so. So we're also talking about what we call Addison Care, which is a complete circle of care. We can do data analytics on the front to identify eligible patients. We have a team that can enroll people into services. We can then provide the hardware for the services, and then we can provide the health coaching or care coordination as well. So we're showcasing that at the show. And then the other thing we're talking about is one of our major partners is a company called MD Revolution. We work very closely with MD Revolution, and we're showcasing some of the interfaces there that have been developed with traditional electronic health records. So Athena Health, Greenway Health, Cerner, Epic, our system plugs into all of those to make it seamless for the clinician and the provider to be able to have the access they need to provide the best care possible. So we're presenting alongside MD Revolution here. What we're showcasing is the integration of our system into various electronic health records. The benefit for physicians there is that there's a single dashboard that they go to, a single set of information that they can access, and what we're able to do is provide them insights in terms of the data that they're receiving, so they don't have information for information's sake. They actually have curated, actionable data that they can look at and then quickly put that into their care plan for their patients. When we showcase that to the doctors and nurses, they were thrilled with it because it really eases their workflow and makes it very actionable for them to take the data coming from chronic care management or remote patient monitoring and inform what they need to do in terms of their care treatment plans. Addison has been evolving since we started working on her probably about 5 years ago. So we had the vision about 5 years ago of this pending shortage of caregiver and how we could use technology and then interactive technology to address that and then create a delightful, engaging experience for the end user. That led to all the work that we've done over the years and the investments we've made to be able to get where we are today to showcase and announce Addison. Addison won't be static. The appearance and the interaction with Addison will continue to evolve. The other thing that will evolve too is what we call the different modules that Addison can help facilitate for you. So to start with Addison, patient will receive a daily okayness check. They'll receive a care plan pertinent to their health condition. They can do medication management and vital signs tracking as well. And then the ability also to receive and make calls to a health coach, for emergency services, or for their physician as well. So it's a pretty robust package of capabilities. We already have planned though to add on to that a scheduling capability. So perhaps there's a conversation with a doctor to be able to have an appointment in a week. We want to be able to make sure that that can get integrated into a patient's schedule. We also are looking to integrate into transportation services such as a Lyft or an Uber Health to be able to automatically schedule a ride as well. We're going to be integrating as well messaging capability, so you can message back and forth with family members. If someone is coming over to visit, you might want them to pick up a prescription or go pick up something from a store as well. So you can just have that level of integration. We've already been able to integrate information from the FDA drug registry database to be able to start tracking whether or not there's any adverse conditions associated with a medication regime that people's on. So over time, we'll just continue to build out both the appearance and visual interactions of Addison, as well as the modules associated with what a patient can do with and through Addison. We're at a really interesting point today. There's been a lot of potential around the ability of health tech to impact healthcare for decades. I think we're now at a tipping point where you're starting to see some early results and now seeing what the potential can do once unleashed to be able to drive better patient care, break down barriers to access to care, and then drive better individual and community outcomes as well. Addison is going to be a big step forward in that direction, and a lot of the other folks who are at HIMSS this year that are doing things that are impactful are going to help create a future of healthcare that we've all been hoping for that now has an opportunity to become real.